Thank you, Acting Deputy President. I also rise today to support and lend my support on what Senator Keneally and Senator McKinn's contributions in this place. Labor, for some time now, has strongly supported the current Medevac laws, and that's because we believe that sick people that are being looked after by government, regardless whether they're in detention or not, deserve the care that they deserve, whether it's here in this country or anywhere else where they are held. And it's very, very important that we make this point, that when someone is sick, they get the best medical care possible. And it was disappointing to hear earlier from Senator Birmingham making remarks that there's been an increase in self-harm, giving the impression that somehow the Medevac laws were to blame. And it is great to know that there are senators in this place, and hopefully the majority of senators in place, that support the Medevac laws. And we certainly do ask and call on the crossbench to continue to lend their support with Labor in ensuring that these laws remain in place. Being a new senator, it is also interesting to see that when governments are required to provide reports to certain pieces of legislation, as is the case with Medevac, every 3 months a document is meant to be tabled in this chamber, and that further demonstrates the Medevac laws are working as they are intended. And we constantly get this government who would keep delaying the tabling of such reports. And you just have to ask the simple question, why? Why do they keep delaying reports, whether it's Medevac or other pieces of legislation? Why does this government continue to hide from the truth? What are they afraid of? And I can only conclude that this proves that Minister Dutton's ongoing scare campaign about this legislation is fanciful. We just have to look at the simple facts. Over the last 3 months, the Independent Health Advice Panel affirmed the minister's decision nearly 80% of the time. 80%. On 12 occasions, the panel overruled the minister so that sick people could get the health care that they needed. Of all of Minister Dutton's claims, they are all refuted with very simple facts. Since March of this year, the Medevac legislation that was passed by this parliament and the government has repeatedly stated that offshore refugees would flood Australia after the laws were introduced, that boats would overwhelm Operation Sovereign Borders, and that Christmas Island was needed and it had to be reopened to deal with the large number of Medevac transferees. However, in the last 8 months after Medevac was passed, all these claims have proved to be false. Christmas Island Detention Centre is empty apart from having one family of 4. Boats have not arrived in any great numbers than previous years, and only 200 people have been approved for Medevac transfers as of this month. But most importantly, Minister Dutton has failed to reveal one crucial aspect of the Medevac operation to date. Of the 200 transferees, the minister has approved 172 himself, which means in 86% of the transfers, he's read the reports of 2 different physicians, agreed that the patient required treatment and approved the transfer without seeking a review from the government-appointed independent health panel. The panel is supposed to review cases where the minister doesn't believe where one's required, but the vast majority of the time, the minister appears to agree with the patient that they require transfer without seeking further medical opinion. But unfortunately, that hasn't prevented the minister or his Department of Home Affairs from trying to allege people are either not sick because they haven't been in hospital for longer than 7 days, or they are refusing treatment in an effort to prevent removal.